Hi, my name is Dr. Tom. I'm the Chief Scientific Officer at Causenta Wellness and Cancer Care Treatment Center. And today's presentation is the effects of exercise on cardiovascular parameters in patients with heart failure. Before we get started, a little bit about my background. And I'm an exercise guy, so I have 23 years of college, basically focused on how exercise can be used to treat health, fitness, disease type issues that people deal with. And over the years, we've learned quite a bit about how the right form of exercise can dramatically improve health and fitness in people with all kinds of medical conditions and serious medical issues. Our goal is to basically eliminate disease from the future of humankind. So it's kind of a big goal. But we're using essentially exercise as a predominant treatment tool or weapon. And the reason why we use exercise is because not only does it work, but besides helping people overcome the medical condition they have, in the end, they're bigger, faster, stronger, more fit, or they're leaner, their brain works better, their mind is sharper. So there's a lot of other benefits besides just dealing with maybe the medical or clinical issues that they have. So I hope you're interested, and I hope you'll follow along as I share some really cool data today on how we take people that have heart failure and how we get these people superhuman so they don't need a new heart. They could actually take their own heart, help remodel it, so they could be healthier than ever. So one of the first things I'd like to get started with is that what do people tell us when they come in? So these are patients that have been diagnosed with heart failure. So they've seen a cardiologist, and the cardiologist has said, hey, I'm going to run some tests, and these tests, tell us you have some dysfunction with your heart. They don't move enough blood every time their heart beats. So sometimes that'll be listed as, or it'll be referred to as, they have a very low ejection fraction. So that means with each heartbeat, they're not pushing out enough blood. One of the things that patients will say is, hey, I have a lot of fatigue. Second thing is they'll say that they have a decreased ability to move or to exercise or do any type of training at all. When they do move, they'll get a shortness of breath. It could be something as simple as just sitting up, right? Like if they were lying down. It could be something as simple as if they walk to the bathroom and have to stop just to catch their breath. In extreme cases, they may even start to turn blue. So there's a color change. They could also get shortness of breath when they're not moving, just from exertion. Sometimes something as simple as going to the bathroom or just leaning against something. The change in tension or pressure in their body can cause them to lose their breath, and they may start gasping for air. Some of the other things that they get, they'll get swelling in the lower body, so that their ankles, their feet, their calves may swell, and they can even get pitting edema. So if they were to put pressure on the tissue and they remove their finger, let's say, there'll be like a dimple or a hole there. They can also get swelling in the abdomen and the pelvic area, and then what will happen is as this fluid builds up, their weight goes up, and then it becomes even more difficult to move. So it's kind of like a catch-22 or self-propagating problem. They're gaining weight, it becomes more difficult to move, they run out of breath, and then every time they try to move, it's more of a strain on their heart. This strain can lead to a either rapid heartbeat or an irregular heartbeat, because their heart does not move as much blood and there's not as much oxygen in that blood, so the heart has to work overtime in order to try to just help this person get enough oxygen around the body. Because of all these fluid balances and these weight change, there may be some nausea. The pressure in the abdomen from the fluid may reduce appetite. There's signals, there's neural and mechanical signals. When there's pressure in the abdomen, it sends signals to the brain. There's an area of the brain in the hypothalamus called the ventromedial hypothalamus, where there's basically a feeding center or a control of appetite there. And so when you have these signals going to the brain from pressure on the abdomen, it basically says, hey, you got enough food, you don't need to eat anymore, even though there's no actual food inside the stomach. And then, of course, that creates the problem. How are you going to repair your heart if you're not eating enough food with nutrients to actually repair the heart? Over time, this can easily lead to difficulty in concentrating, decreased alertness, and in some cases, chest pain, could be the signs of a heart attack or something is happening. So these are the symptoms that people will say, hey, this is what I'm experiencing, when they first say would contact us, so before they began any actual treatments at our center. So once patients come to our center and kind of share with us some of the issues they have or symptoms they have, many times also say to us, well, here's what my doctor told me. And some of these things I want to address because they're kind of the opposite of what I would actually tell someone to do. So as an example, patients will be told, hey, if they're smoking, stop smoking or don't smoke. They'll be told, hey, you got to get active again, you got to lose some weight, and you got to keep a healthy weight in order to reduce the stress on your heart. You got to eat healthy. We got to do things to control your blood pressure and diabetes, and then you got to reduce and manage stress. And at face value, these sound like very logical things to make, to recommend to someone. The problem now is that how do you take those recommendations, those guidelines, and translate them to action plans, like to precise steps that actually produce the result? And this is where I see a lot of patients really struggling. So if you did smoke and someone says stop smoking, anyone that's been smoking for a while, they know how hard it is to stop smoking. You don't just say, I'm going to give it up and then just throw the cigarettes away and magically everything's better. Many people struggle with that. So to make things easier, we have all kinds of tools. We have different homeopathic drops that people take, and they actually lose the ability to want to even smoke a cigarette. Some people, we could even do acupuncture. Some people like that instead of taking drops. But the point is that we have different strategies to make it an easier transition to go from smoking to not smoking. But imagine what I was saying earlier, that if you're gaining weight because of fluid, how are you going to go and start exercising more when every time you take a step, you're running out of breath and you're turning blue? So it's one thing to say, hey, you got to exercise, you got to be more active, but it's a whole different matter to make it easier to do so. And the question becomes, well, how do you exercise if you turn blue and get fatigued every time you try to move? And what I'm going to show you in some later slides is that we have this all figured out. We actually have ways of making it easier to move for people with really weak hearts and have very low ejection fractions. And in terms of eating rate, it used to be years ago, you would say, these foods are healthy and these foods are not healthy. Today we have this concept called precision medicine. We could test your immune system, we can test your genetics, and we can find out precisely what foods affect your body, like which foods are inflammatory, which foods actually reduce your risk for heart disease, or which foods could help you fight heart disease. These are critical details that you can only get from testing. You can't just come up with a diet plan and give it to someone randomly or give it to everybody with a diagnosis of heart failure and expect them all to get great results. Those days are, that's kind of outdated, misleading information, and we move beyond that now with precision medicine. Then we get into areas like how are you going to control your blood pressure or diabetes or reduce and manage stress when there could be very specific reasons why you have those issues, and someone else with the same diagnosis of heart failure, they could have different reasons for those issues. So the recommendations for one person can be very different than the recommendations for a second person, and those different recommendations are necessary so they both can achieve their goals of having a healthy heart. So people with heart failure, people without heart failure rather, when they first exercise, they're going to use up some oxygen in their blood. Let's say if they're on an elliptical device or they're just walking. And as they use up some of this oxygen, it sends signals to their heart to, hey, beat faster. So you breathe in more air, the oxygen gets extracted from the air, that oxygen makes it through your lungs down to the smaller parts of your lungs, it gets into your red blood cells, and your heart pumps those red blood cells back out to the rest of your body. And the faster or the more intense you move, then the faster your heart beats, and it keeps basically going up until you get to like a maximum heart rate. And once you hit that point, the heart's not going to beat any faster, but then your ability to exercise or move will reach a plateau. When you have heart failure, it's a different situation because your blood levels of oxygen are lower and your heart is weaker. So you can't get as much oxygen to your muscles and your brain and other organs or tissues. And when you do breathe, you're not getting as much oxygen out of the air into the blood to get to those working tissues. And so what happens then is your heart works overtime in order to get some oxygen to the rest of your body. So it's very restrictive. You can't do very much, and then you're fatigued, or you have to, take a moment to catch your breath. Those limitations make it really, really difficult to try to exercise to lose weight, or to kind of prevent diabetes or regulate blood pressure. So it sets up then the challenge: how are you going to get healthier if the very things you have to do are difficult to actually do? So we've come up with a strategy for heart failure, what we call, I guess, a heart failure treatment solution, maybe making it simpler. And what we did is we studied people with heart failure, and then we said, okay, what's really holding them back is they simply don't have enough oxygen. So once we get them enough oxygen, they can actually move much better. So we created an exercise model where we have people breathing in oxygen that's around 86 to 93% pure. So they have like a face mask with a hose or tubing, and that connects to a bag which stores this oxygen. And we have them moving on an elliptical device, and the reason is many of these patients are heavy, and we want to minimize reaction forces in their joints so that we don't create any joint stress for them as they're trying to lose weight. Well, once we get the oxygen into their body, we could see dramatic improvements in their ability to perform. And then we also test them, and we find all these inflammatory conditions and micronutrients that are low and hormone imbalances. We find quite a bit of information that's specific to what they're dealing with that we later will address once we have the test results back. And then we create essentially an environment where we're addressing these inflammatory markers. We get them into a situation where they can exercise in a safe way, and then we provide building blocks that actually helps their heart to start remodel or repair itself. And then we retest them or evaluate them over time, and we make micro adjustments as needed, and we monitor them to make sure things continue to stay safe. From testing patients that have heart failure, we've uncovered a ton of clinical findings. I'm going to take a peek at some of my slides and kind of share with you some of the observations we have for people with heart failure. We found high ferritin levels, high CRP, high liver enzymes. The ferritin and the CRP you could think of as inflammatory markers. The liver enzymes mean that there's some oxidative stress, there's some challenges to the liver. We'll find high LDL, high oxidized LDL, high myeloperoxidase, high homocysteine, and even NT-proBNP, which is another marker for heart stress. Essentially, what you find is that there's a lot of dysfunction with lipid metabolism, and there's a lot of inflammatory markers that are elevated. Some of them are due to inadequate B vitamin status. And the reason why it's critical is not only do the B vitamins provide a way to reduce inflammation, but they also help provide energy, and they make it easier for the body to convert, say, fat and other fuel sources into energy. We've also found thyroid dysfunction and immune dysfunction, and this may or may not be directly related to their heart failure. And the point about that is, let's say if you're someone that has heart failure and you're fatigued, many times a doctor will say, oh, that's because your heart is weak, that's why you have fatigue. But even if your heart is perfectly fine, if you have thyroid dysfunction, you could be fatigued as well. So how does anyone know what's causing your fatigue if you have multiple issues going on at the same time? And the reality is they don't. So what we do at Causenta is the doctors here, they're going to address everything they find. So if you have a problem with your thyroid, they're going to fix it. If you have a problem with the heart, they're going to try to fix it. If you have issues with low vitamins, they're going to address that too. So that way now, from a biochemical and physiological perspective, there should be no reason why you have fatigue, which then sets the stage that it's easier for you to exercise, improve your fitness, and help your heart get stronger again. Some other things we found that I think most people never consider is a lot of microbiome issues. So we find a lot of people with heart failure have issues with the bacteria and the fungi and the other types of organisms growing in their digestive tract. These organisms are important because they control gene expression for inflammatory molecules in the human body, and they also help sort of control how the immune system works to some degree. So if your microbiome is dysfunctional, you may have more inflammation, which will make it even greater stress on your heart. We've also found people with food reactions. A common one is wheat. So imagine that every time you eat wheat, it creates some stress to your digestive tract, and that stress results in you having less absorption of certain micronutrients. Now those micronutrients may not be adequate for you to repair your damaged heart, and this could be one reason why your heart has gotten weaker over time. We've also found people with different types of infectious issues, and one of the things that is clear is that a lot of these infectious issues can be really damaging to different types of tissues in the body. And I bring that up because they're not traditionally measured or looked at all by cardiologists. Typically, those types of organisms will be looked at by a different doctor. But if once you have the diagnosis of heart failure, most professionals are going to say, hey, you need to see a cardiologist, and have your cardiologist do your workup and see what's going on. But there's areas of your health that are typically outside the scope of practice of a cardiologist. So, it's kind of like this spiral. How do you get better if you have a problem, but no one is looking at that problem? Well, the reality is you're probably not going to get better. And I highlight this because what we do here is we look at all these areas because we can't label you and say, oh, that's okay. Instead, what we do is we measure it objectively, and then we say, oh yeah, we found out what's going on there. Some other clinical markers that we've measured or discovered in heart failure patients is that some people have genetic predispositions. So they have a mutation in a gene that makes the contractile proteins in their heart weaker or easier damage, or they may have some other issues with collagen fibers in their connective tissue. These things matter, and it requires that you have a strategy in place to minimize the damage in these structures over time. Otherwise, even if you fix the problem now, you're probably just going to have more issues later on. We've also looked at things like mycotoxins. These are the chemicals from molds. We found fungal antibodies, things like abnormal bleeding conditions, and proteins that they're traditionally associated with memory decline, and even cytokines, which can be very inflammatory signals for the immune system. So my point about sharing a lot of this stuff is if you got these things happening inside of you and they are not addressed, all you're going to have is more damage over time, and then that puts you on a journey where the final result is you need a new heart. You have to have a heart transplant. And what I'm saying is, if we address these issues, then we can actually help your heart to get healthier again, and then you won't need a new heart. So I guess a summary point that I can make is with all those variables that I just highlighted, if they're not addressed, it's how could you expect someone to get healthier? And what I'm seeing right now with patients is that all those things are being ignored right now by many clinical practices that are supposed to specialize in heart failure. What I'm seeing is that patients are put on drugs, and then they're basically being managed until they need heart surgery. And my thinking is that, well, there's a way to avoid heart surgery if we actually help the heart to get strong again. And a lot of what I'm suggesting, it's not really that new. There are many physicians that over the years have discovered all kinds of ways to help the heart get healthy. There's other exercise physiologists that have showed that if you breathe in oxygen when you exercise, you reduce stress on the heart, and that could be the foundation for helping the heart get its strength back. But some of the things that we've done a little differently is we've identified more clinical markers that need attention in heart patients, probably in any other center in the world. And because we have all these precise details that we're measuring, it puts us in a position that we have more opportunities to improve the function of the heart. And these are things that, unfortunately, many people don't even know about. So it's kind of like, imagine if your car had 4 flat tires and a broken windshield wiper and had a hole in the fuel tank, and there's all these problems with it. But all you could see was the flat tires. You don't see any of the other damage. You could fix those flat tires, but you still have a car that doesn't work right. And that's kind of like where we are now with heart failure. There's all these opportunities to make improvements, but they're simply not being measured or monitored. And so it's kind of like take drugs, get a new heart. And what I'm suggesting is that, well, there's things we could actually do to improve the health of the heart. And by the way, maybe avoid the necessity of taking the drugs, and definitely avoid a heart transplant or heart surgery later on. So when we first have someone come in, a common question we'll get is, okay, if I have heart failure and every time I move I'm turning blue or I'm running out of breath, how are you going to get me to move safely so I don't have these same symptoms? So we came up with some exercise for heart failure patients guidelines. And essentially what we do is we have them breathe in oxygen while they're moving. And the patient initially will determine a pace themselves that they're comfortable with. So no one's going to be like, hey, move it, or force you. You get to walk at a pace you feel comfortable. And as you're moving and things feel easy, you naturally will move a little bit faster. And if that feels easy, you'll move faster. So you're going initially by comfort. And then if it feels a little difficult, you just slow down. And so what happens is we provide enough oxygen that your brain and your heart and the rest of your body have all the oxygen that they need. So if every cell in your body has all the oxygen that it needs, then it reduces the stress on your heart to have to beat as quickly. And one of the things that we have found is that with our exercise model, the heart rate for our patients is lower than if they were doing a different exercise model. So we basically have shown that we reduce the stress on the heart. And so this allows then people to exercise harder at a lower heart rate. And so then they could start strengthening their heart through progression. Whereas without the oxygen, they would fatigue right away, and they would never get to a point they can get the heart working hard enough to get stronger. So what does a program look like? So a heart failure exercise program looks something like this. So the first workout, someone comes in, and we just see what they can do on their own. So they're breathing room air oxygen, and they're going to, usually we start people on an elliptical device. And the reason for the elliptical device, I mentioned earlier, but I'll just emphasize it again. Many of our patients are overweight or obese, so we want them to move in a way that doesn't aggravate any pre-existing joint conditions or create new orthopedic issues as they exercise. So we use an elliptical device that minimizes ground reaction forces back into the joints. So they basically can train harder, and their knees and ankles or hips don't ache anymore, or any more than maybe they had in the past. And so we start them initially, there's supervision, but we see what they could do on their own. And many patients, they may only get a minute or 2 minutes, and then they're already tired. They can't do a whole lot. So that would be day one. And I think of that as a baseline. So now we establish what they could do on their own. Then day two, we actually have them with a face mask hooked up so they can breathe in oxygen. So the oxygen will be between 86 and 93% pure. And now they move in the same elliptical device. And now we see that that same person, that can only do 1 or 2 minutes, the next day they could go 10 to 20 minutes. And then when they get done, what they'll always say is, I can't believe I was able to go that far, last that long, and I wasn't getting a shortness of breath. And so we reemphasize, well, in the past, you had a limitation of oxygen delivery to your body. So of course you're gonna fatigue. Something that you need is missing. Well, now we've overcome that obstacle. We're giving you all the oxygen your body needs. So now it's no longer rate limiting or holding you back. So now you're in a position where you could do something safely, and because it's safe, now you get confidence to push your body harder and harder. And we've literally had people that come in that say, I can't go up steps and I can't walk 20 feet without stopping. And within 3 to 7 days, those same patients with heart failure, they are now maxing out cardio equipment. So they're doing resistance of 400 pounds, and they're using their arms and legs and moving the same resistance that elite athletes would use. And the reason for this is we focus on removing limitations to that individual's physiology so now they could move much better. And within 24 hours, people tell us, I can't believe how much progress I made. And within 1 or 2 weeks, it translates to dramatic improvements. So loss of body fat, reduction in glucose levels, improvements in cholesterol, lipid metabolism, dramatic reduction in inflammatory markers. And then over time, we can even see gains in lean body mass. And the other thing that people talk about is how much sharper their mind is. Like they could think more clearly and they can process more tasks with ease instead of being stressed out. So one of the questions that we'll get asked is, okay, so how long do I have to do this for, or how long does it take for this to be permanent? So with our heart failure exercise program, what I could tell you, if it was like a perfect world and I could say, look, come here and do this, I would recommend most people consider like 8 to 12 weeks or say 2 or 3 months. And the reason is the condition you have, it took time to get there. It just didn't happen instantly. So it's going to take time to repair some of the damage, address some of the findings, and then try to create a lifestyle where now you're used to doing all the things we're teaching you. And we know for a fact that at 3 months, there's dramatic remodeling and improvements. We could see improvements in the ejection fraction for patients. Many times they'll go back to cardiologists, and the cardiologist will be shocked. How is your heart putting out more blood with each heartbeat than it did before? And then we try to explain this is what we're doing. We get mixed reviews. Some doctors will say, oh, it's good. Some doctors don't kind of buy into exercise being that powerful. But I think what they're missing is that it's not just exercise by itself. We've run all these other tests and we're finding details about this individual's body. And it's that synergy of the exercise that's appropriate with all these other things that we're doing that really produces the enhanced results that we're experiencing. So as an example, a lot of times when people have heart failure, it's not just that the heart is mechanically weaker. It's not just that there's low oxygen, but they also have issues where the creatine stores and the ribose, like all these energy molecules are very low. So in terms of what we could do to help them, well, it's kind of logical. Everything that's low, if we could build that back up, we're basically reinforcing all the energy systems in this person's heart. So now the heart doesn't have any obstacles holding it back, hence no fatigue. So imagine if you're missing something and now we give you that something is no longer going to be holding you back. And that's basically what I'm referring to here. So examples of tools we've used for different patients. We've done stuff with creatine monohydrate, because that increases ATP and creatine phosphate levels. We've done stuff with Ribose. That's an excellent tool for people with heart failure because it allows you to generate ATP without oxygen. So that's, like worth its weight in gold for many heart patients. And the sad part is not a single patient that's ever come into our facility has even heard of this stuff. And you're like, well, what did your cardiologist talk to you about? I would expect that they were told about some of these things before they walked through our door, and what I usually find is they never heard of it. Some other things that we use also is CoQ10, so coenzyme Q10, and acetyl-L-carnitine, and there's other tools that we use, but essentially we're looking at things like, how do we increase HCP production, and how do we reinforce the different steps of the electron transport chain to help these people make more ATP. Then in terms of like structural repair, let's just say like there's a lot of trabeculations, or there's like the heart looks like there's like a lot of missing protein to it. We could do things with peptides, exosomes, and stem cells. And there's different protocols and strategies that we use there, but essentially what we're doing is we're trying to send signals to increase tissue repair of the heart. And when all this stuff is dialed in, the results are real impressive. People will come in and then leave, and their family's like, oh my God, you're like a new person. Because imagine if you can't breathe, how confident are you to go anywhere, to go, travel, even go to like a movie with your loved one. But now all of a sudden, when you can breathe and you don't get tired, you can do normal activities of daily living with no issues. Well, now you start expanding your horizon. You start going, maybe you're going to go out dancing. Maybe you're going to go out to a play or food shopping or something. You don't have the barriers holding you back anymore. And what your family or loved ones will see is before the old you couldn't do anything, and now the new you is going to want to do everything. So it's kind of like quite a bit of dichotomy, the old you versus the new you. So one of the things that has to be considered in exercise for patients with heart failure. So it has to include a number of things to make sure that in the end, there's permanent lasting changes. Some of these components is that there's got to be oxygen that you're breathing in, and I don't mean just the oxygen that's in room air. There's got to be oxygen at a higher concentration than what you're breathing in, because that creates the passive diffusion gradients, meaning if I have a mask that's hooked up to a bag and that bag has more oxygen and a greater concentration in which in my cells, then there's going to be a natural force for those oxygen molecules to get into my body, want to connect everywhere or travel everywhere. So simply stated, you can get more oxygen to your cells when it's a higher concentration than you could just room air. And you want that to happen when you're moving. And right now, my belief is that exercising with oxygen is superior than hyperbaric oxygen therapy. One of those reasons is there's no movement with hyperbaric oxygen therapy. And we get way better tissue perfusion when someone breathes oxygen while they're moving than someone just laying in an oxygen chamber under pressure. The other thing that we get is we get dramatic improvements in fitness. You don't get that with hyperbaric oxygen therapy. And we could also apply multiple modalities at the same time. Like we could do things with light therapy and magnetic energy, and you could not do that with the hyperbaric oxygen therapy. Another thing that's critically important in terms of reducing stress on the heart is to increase strength of your muscles on the outside of your body. So what I'm talking about is your skeletal muscles. And to really maximize those results, you need a different environment than the environment that helps repair the heart. And so proper resistance exercise requires someone that's competent and understands how do you get someone stronger that may have heart failure issues. And this activity, so if you take the total time of, say, cardiovascular activity and resistance exercise, you add them up, you're going to start out maybe 10 minutes a day, very low, but we're going to gradually increase that to 90 minutes a day. And what you see during that time, from 10 to 90, is dramatic improvements in the fitness, in the appearance, and these other variables of the human body. Very few people can do this on their own. It requires competency, it requires someone with exercise understanding that knows what's going on, and it requires the tools and resources to support you when things get challenging. And we've basically created that environment at our clinic to make it way easier. So when someone finally gets discharged, they don't need all the resources when they go back home. They may need a few things to keep up the momentum, but they don't need an entire center to support them when they go back home. So what have we learned with the information I shared today? So one of the things that's critically important is that heart failure patients have significantly reduced abilities to move safely, and they often live by fear. So if you take a step and you're breathing heavy, you become inhibited in taking another step. If you just stand up, when you're turning blue, it then creates all this fear about, okay, am I going to have a heart attack any minute now? So I won't move at all. So there's like a lot of challenge with movement based on fear alone. And that fear could be, losing control of your breathing or having a heart attack. Now, what we can do, though, is we can create a safe environment where we remove the obstacle of getting oxygen to the rest of the body, and instantly that fear is removed. Because if you could stand up and you feel great, and if you could move and you don't have any issues at all, you're not breathing heavy, you don't feel like your breathing's out of control or something, then you naturally want to move a little bit more. And as you move more and you see your body transforming, you're moving better, there's no shortness of breath, and you're sweating again, and you feel good, then that sets the stage where you want to keep doing more of what feels good. And at Causenta, we got that figured out, how to help you move safely. And some other points that I think are real critical is that heart failure patients have a lot of issues going on the inside. There's a lot of inflammatory markers. Where those markers are directly linked to the lack of oxygen and heart failure, or is it like something else going on at the same time? It's difficult to say because there's a lot of stuff that we're seeing. But what is important is that it all gets addressed. So whether your inflammation is high because of an infection or because of arthritis, or if your inflammation is from your heart failure, in the end, it has to be addressed, right? So if it's an infection, that has to be treated. If it's arthritis, we're gonna figure out how do you make it so you don't have arthritis anymore. Or if you have heart failure, how do we make sure your heart's healthy again so we can reduce those inflammatory markers? And when we do these things in a nice cohesive fashion, you get dramatic improvements in how people perform. So if you found this presentation informative and you feel like you want to get started, all you have to do is just go to our website. I have the link in the slide here. It's just causenta.com/contact us. If you just go to the main page and then you scroll down a bit, you'll see that there's an option to contact us, and you just fill out a form. And the way it works is the first conversation is no charge. I basically share a lot of the stuff I just presented in this presentation to you. And I'll say, here's how we approach it, and here's the things that we'll do. And then if you're interested, then we'll get you set up more formally, and then there'll be, we send you, here's our fees for the different services that we provide. And then, we'll get you, scheduled to come in, do some consults, get some blood work and other tests done, and then get started with trainings that would help you improve your heart and dramatically increase the quality of your life. So I hope you found this entertaining and educational, and I look forward to meeting you in person.